You're listening to Boomers Today with your host, Frank Sampson.
Well, welcome to Boomers Today. I'm your host, Frank Sampson. Of course, each week we bring you important and very useful information on issues facing baby boomers, their parents, and other loved ones. And as I do every show, I thank all of you. And I thank all of you because our listeners are growing each and every day. And it's because of you. So many of you have shared our podcasts or individual shows with friends and family. Many of you listen to the podcast on Apple Podcasts, Google Podcasts, Spreaker, Stitcher, iHeartRadio. There's many more, and we're on them all. So thank you for that. And I do know exactly why you share our show with so many people. It's because we've got great guests on our show and very knowledgeable, and we're not going to disappoint you today. We have with us Dr. Andrew Budson, who is a chief cognitive behavioral neurology at VA Boston Healthcare System, also associate director of the Boston University Alzheimer's Disease Research Center, professor of neurology at Boston University, and lecturer in neurology at Harvard Medical School. He's written 9 books, including 6 Steps to Managing Alzheimer's Disease and Dementia, Why We Forget and How to Remember Better, and his latest 7 Steps to Managing Your Aging Memory, now in its 2nd edition, which explains how to distinguish changes in memory due to Alzheimer's versus normal aging, what medications, diets, and exercise regimens can help, and best habit strategies and memory aids to keep your memory strong. So that's a mouthful, but well-deserved. It's tremendous what you have done, Dr. Budson, and thank you for joining us on Boomers Today. Really appreciate it.
Yeah, thanks so much for having me.
Yeah, so I'm going to hit you with a tough one. I don't know if it's going to be tough for you, right? Nothing's going to be tough for you, but we hear all the time, about curing Alzheimer's. I know through the years I've interviewed researchers. Some have doubted whether there's going to be a cure in the near future, maybe a slowing of progression. Different opinions out there. All right, but things are changing. Things are changing all the time. We're constantly hearing about new research that is done, new drugs, procedures, etc. So what are your thoughts there?
Yeah, it is such an exciting time to be a clinician helping to diagnose and treat individuals with their memory problems, because, today, for the first time in the, I hate to say more than 25 years that I've been in this field, we finally have a treatment that can significantly slow down the disease process. And let me just say briefly what this means for people today who are diagnosed with Alzheimer's disease, but also what it means for all of your listeners out there who are concerned that they may be at risk for getting the disease in the future. So for today, what this new medication can do is it can slow the disease down. And the way it works is it's actually an antibody, which is what your body uses to fight off infections. But this is an antibody that's made in the laboratory. It's injected into the vein every other week, and it sticks to any of these amyloid plaques, these Alzheimer's amyloid plaques in the brain that sort of starts the process that ends up destroying brain cells. And once it sticks to these plaques, the body's immune system comes in and says, hey, there's an antibody on this, so that must be something bad, so I'm going to get rid of it. And the studies have shown that these types of treatment, and the only one that is FDA approved that I would recommend is called lecanemab, brand name Leqembi, that it can slow down the disease process. At the Veterans Affairs Boston Healthcare System, where I work, I'm very proud to say that we have 12 patients getting this treatment. We're actually the only VA in the country who is currently infusing patients for this, although a few other centers are just about ready to get started. And it can slow down the disease so that every 18 months, people are basically somewhere between 3 to 4 months better off than they would be without this medication. Now, that may sound like a small improvement, but if we now think about, well, what would happen if we actually started this earlier? So let's just imagine the future for a minute. The future, in my view, is that we're going to be screening people for these Alzheimer's amyloid plaques early on, when people are, say, in their early 60s. So maybe just like you get a screening colonoscopy for colon cancer at age 50, let's say you get a screening test for Alzheimer's at age 60. It'll probably be a blood test. And if it shows that you were developing Alzheimer's disease at age 60, way before any symptoms come on, because it takes maybe 10, 15 years before any symptoms show up, maybe 20 years. If there's any Alzheimer's plaques building up in the brain, with this existing new class of treatment, the amyloid plaques can be removed from the brain before it causes any damage to the brain, before it causes any memory loss. So from a functional standpoint, we will have a cure for most people.
So, wow. That's all I want to say is wow, but I just want to do a follow-up question, a couple follow-up questions for you. So is it just a blood test that would help determine if someone could develop those plaques or has a high probability of developing those plaques? Is it just a blood test?
Yeah. So today, the way to know for sure that someone has these amyloid plaques building up in the brain, we use either a special imaging study called an amyloid PET scan, or we use a test in the cerebral spinal fluid. So we do a lumbar puncture, a spinal tap on someone, and we can measure the changes in the proteins there, both amyloid and tau. So today, we use these amyloid PET scans and spinal taps, but in the near future, and I would predict by about 2 years, we should have blood tests that are going to be quite sensitive and specific to be able to diagnose Alzheimer's disease. So that's why I think in the future, it's going to be a blood test.
So you mentioned, you brought up 60 years old. Is that an age that you just kind of came up with as an example, or is that what FDA is saying, that it's for people at least 60 years old that, you know, maybe insurance is going to pay for the test? Or, I mean, I don't know how all that works with insurance, but
yeah. So what I sketched out is what I see as the future state, you know, what I expect is going to happen in the future. So it's definitely my opinion and not something that the FDA has latched onto. The reason that I suggest beginning screening at age 60 is because we know that it takes 10 or 15 years for the amyloid plaques to accumulate enough for the plaques to start damaging brain cells, which causes the tangles to get formed inside the brain cells, and it's these tangles that actually kill the brain cells. So the idea is, if it takes 10 or 15 years for this process to occur, and people might start developing Alzheimer's disease in their 70s, so we'd want to start screening people early, and perhaps if the brain is totally clear, maybe screen them every 5 years or something like that. Just like, again, like the colonoscopy analogy, to be able to detect the disease early and get rid of it. And I should add that there is actually a clinical trial going on right now with this drug lecanemab to see if they can take people who, again, have these plaques in their brain but don't have significant memory loss now. So they don't actually have a diagnosis of any disorder. They're basically, if they saw a neurologist, neuropsychologist, they would be diagnosed as just having normal aging. But they have the plaques in the brain, and the study is going on right now to see if by removing those plaques, we can prevent Alzheimer's from occurring clinically. In other words, prevent any deterioration of memory.
So, your thought is, let's try to hit the majority of people. I mean, obviously, I see it, you must see it, people getting the disease younger and younger, it seems to me. I don't know if there's any statistics to show that, but we may miss those. Like somebody, the colonoscopy is a good example. Somebody might get colon cancer in their 40s or 50s, because they weren't screened. But you're saying let's just go for the majority.
Exactly. I think if we start screening at an early age, we will be able to detect these Alzheimer's plaques developing in most people before there's any memory loss, because that's the key. The key is to initiate this type of treatment early, and that's what will give us sort of a functional cure, because we'll remove the plaques from the brain before they start to do damage, just like removing the cancer cells before they spread.
Gotcha. And you mentioned the name. For our listeners, because some might want to do a little more research on it, spell that for us, the name, lecanemab.
Yes, absolutely. So lecanemab is spelled Lecanemab.
Gotcha. Okay, interesting. This is this is pretty big. This is pretty big.
Yeah. And since we've talked about the pros, I probably should just give a sentence or two about some of the side effects.
Great.
So the main side effects of this medication is when it sort of works almost too well. So what we want to do is we want to get the body's immune system to work for us and, remove these amyloid plaques from the brain. So how does that happen? Well, when the antibodies are there, it triggers an immune response. It triggers like the white blood cells, to go in and to start cleaning up all the plaques. So the main side effect is when that immune reaction is too vigorous. So if it's too vigorous, two different things can happen. One is that there can be a little bit of swelling in the brain, again, from that immune reaction. And that can cause, it's actually usually asymptomatic. People don't have any symptoms, but sometimes people can get confused. They could get a headache. In rare cases, it could actually cause a stroke. and one person has actually died from it. So brain swelling can happen. And then the other thing that can happen is people can get some bleeding in the brain, again, related to the process of this immune response. And most of the time, the bleeding is teeny tiny, and it's not really important. And, we would just stop the infusions if the bleeds are popping up. Although, again, a few people, mostly those who were on blood thinners, have died from the bleeding. So I do think this is the future, but this drug is not without side effects and risks. And some people, for example, such as those on powerful blood thinners, may not be the best candidates for it. But I do have confidence that there's going to be even better drugs that are going to be developed in the future with fewer side effects.
Got it. Well, great. We're gonna take a real short break. All right. All of us could take a little breath here after hearing that, which is great. Great. Good news. Nice to hear that. We're gonna just recognize our sponsor, and we come back. We want to learn more about what you're doing, a lot of the books that you have written, and we'll continue our discussion. Okay.
Sounds good.
All right. So do you know anyone who may be concerned about an older driver? Well, Senior Care Authority's Beyond Driving with Dignity program is a facilitated self-assessment program for older drivers. The program has been designed to serve as a vital tool to facilitate older drivers and their families as they make appropriate decisions regarding the future of one's safe driving career. If the individual is a safe driver, an advisor will provide him or her with strategies on how to remain a safe driver as they progress through the aging process. If driving retirement is the appropriate decision, then the individual and their family are offered possible alternatives, resources, and a specific plan to ensure a smooth and successful transition from the driver's seat to the passenger seat. So to learn more, go to www.beyonddrivingwithdignity.com or call 877-907-8841 to connect with a Senior Care Authority advisor in your area. We are back with Dr. Andrew Budson, who's been sharing some pretty exciting news about the opportunity of curing Alzheimer's. But we're going to continue that conversation. But Dr. Budson, tell us a little bit more. I know you've written quite a few books. I've written a book myself. It took a lot out of me. You've written 9. I don't know how you do it, but talk to us about that and some of the things that maybe people could connect and learn. Some of the things that you're doing and the organizations that you're with are some of the great achievements they're making.
Sure, absolutely. So it really is an exciting time to be caring for people with memory loss, because there's really a lot that we can do. And the first book that I wrote, I wanted to make sure that all the primary care doctors who are out there and nurse practitioners and other professionals, healthcare professionals that are seeing these folks would feel empowered, even if they're not a specialist, to be able to recognize when one of their patients is beginning to have memory loss, to make an appropriate diagnosis of some of the most common disorders of memory, including, for example, Alzheimer's disease or vascular dementia, and be able to start them on treatment. So that was the first book I wrote. It's called Memory Loss, Alzheimer's Disease and Dementia, a Practical Guide for Clinicians. But what I soon realized is that helping to educate the primary care doctor is good, but usually the only doctors who are going to buy a book like that are the ones who already are interested in this topic or trying to identify it. And, my heart goes out to the primary care doctor who is so busy with so many different things. And, they might not have time to worry about their patient's memory loss. And I was seeing a lot of patients who would come to our clinic and they would, say, Dr. Budson, you're telling me that the symptoms I had 3 years ago were the start of Alzheimer's. I told my doctor about these symptoms when they started 3 years ago. And my doctor said, oh, Mrs. Jones, all my patients your age, have that type of memory problems. Don't worry about it. It's normal. And I realized I really needed to work to empower the individual themselves to know what type of changes in memory are normal and are part of normal aging, what types of memory changes are actually the start of Alzheimer's disease, and in either case, if you're trying to keep your memory strong, what one should be doing about it. And that's actually the 7 steps to managing your aging memory book that I wrote, and now in its second edition. And then the other 2 books I wrote, one is for the next biggest problem that I saw in the clinic, which is families trying to care for their loved ones who are really in the middle of Alzheimer's or another kind of dementia, and they're trying to know what are all the things that they can do without drugs that can be helpful, and which drugs are helpful, and what do we do at the end of life, and things like that. And then the last book is really sort of for everybody else. It's for people who are older or younger. What can they do to maximize their memory? And that book is Why We Forget and How to Remember Better. So those are a little bit about the books and why I wrote them.
Wonderful. Well, I'm glad you have done that and continue that wonderful work. So, continuing on with our discussion, I know you and I continue to use the term or the name, Alzheimer's disease, and some of the recent developments to hopefully bring us closer to a cure. But, as we know, Alzheimer's is a form of dementia. Even though that's the majority of cases out there, there are many other forms of dementia. So what we've been talking about, these recent developments, do you see them as the possibility of helping other forms like Lewy body, vascular, or are we just talking Alzheimer's right now?
Yeah, that's a great question. So the treatment that I was talking about will only work for Alzheimer's disease. And as you say, it is the most common cause of dementia. Probably about 60% of people with dementia, it's estimated that their primary problem is Alzheimer's disease. So for that 60%, that treatment, the lecanemab and treatments like that hopefully will be coming out soon, will be hopefully effective in slowing down their memory loss. But for people with vascular dementia, which is due to strokes, or Lewy body dementia, and more rarer types of dementia like behavioral variant frontotemporal dementia, right? The drugs like lecanemab will not work. But the good thing is researchers are working to try to develop analogous type of treatments that may help some of these other disorders, or treatments such as vascular dementia, which is dementia due to strokes. There's a lot that one can do to reduce the occurrence of strokes through exercise and eating right, and managing cardiovascular risk factors like cholesterol and blood pressure. So I honestly do think there are ways that we can work to at least reduce the chances of developing these other types of dementias as well.
Gotcha. Okay, good. Well, that's good to hear. So, I know we have, I'm sure, several people listening to this podcast who have a loved one that maybe has been recently diagnosed, maybe with MCI, maybe early stage. So what's your thought? What would you say to them if they said, is there hope for my loved one?
Absolutely. So when someone's diagnosed with mild cognitive impairment, I would definitely see if they're eligible for that medication that we talked about earlier, the lecanemab. But I would also start them on the standard treatment for memory loss, which is a medication that increases the levels of a chemical called acetylcholine in the brain. These are medications that I bet some of your listeners know about. These are medications like donepezil, whose brand name is Aricept, or rivastigmine, whose brand name is Exelon, or galantamine. All of those raise up acetylcholine in the brain, and although they're not FDA approved for mild cognitive impairment, they absolutely work for the majority of people with mild cognitive impairment, and help to sort of, the way I describe it is they can sort of turn the clock back on their memory loss and make their memory the way it was 6 to 12 months ago. Now, this class of medicine, unlike lecanemab, cannot slow down the disease progression, but it can turn the clock back on their thinking and memory problems. And I would definitely encourage them to eat a healthy diet, which is a Mediterranean menu of foods, and to get regular aerobic exercise, because those things will also help to slow down going from mild cognitive impairment, which means function is normal, into dementia when function is abnormal.
Right. So, we hear that all the time. So I'm glad we can't say it enough. Exercise and Mediterranean diet. We hear about other things, all sorts of articles that are written, is red wine good for you? Is other forms of alcohol not good? What about cannabis? I mean, those types of things. Can you clear some of that up for us?
Yeah, absolutely. So the reason in the past that we thought that red wine was good for you is it seemed that if people had there was an association that people who drank one alcoholic beverage a day, whether it was red wine or something else, had less Alzheimer's disease and dementia. But we figured out that the causation was actually different. It turns out that most experts now agree it wasn't that the alcohol was reducing the likelihood of developing Alzheimer's or another dementia. It's actually that when people start to develop Alzheimer's or dementia, then they stop drinking, is what happened. So it turns out that alcohol is actually not good for us. There doesn't really seem to be any study that, at least in my opinion, has really shown that alcohol is good for you. Now, having said that, there is not a lot of studies out there that show that one alcoholic beverage a day is bad for you. But there are studies that, once people start to, be drinking more than one alcoholic beverage a day, it probably is not that good for you. And the World Health Association now basically recommends that people don't drink. So, I drink alcohol once in a while. I like to have a beer if I go out to a ball game. I, like to have an occasional glass of of red wine with dinner. So I'm not saying, people need to completely abstain, but there isn't any evidence currently, in my opinion, that drinking alcohol is beneficial.
Yeah.
Now,
Go ahead. No, go right ahead.
So cannabis is very interesting. And, what I would say about cannabis is, the whole plant, so both the THC, which is sort of the psychoactive part, as well as the cannabidiol, the CBD, it does, if you're taking the whole thing, it probably does interfere with thinking and memory. There are studies that show that it interferes with procedural memory, which includes doing things like driving. It interferes with your episodic memory, which is your memory for episodes of your life. That's sort of usually what we mean when we talk about memory. So it's probably not a good thing to use. CBD, on the other hand, cannabidiol, there is actually some intriguing studies to show it might potentially help with memory. And there's a lot of work to look into whether or not it can help with things like anxiety. But the role that I really see that cannabis, even with the THC, can be helpful is when people are on other powerful drugs that are having a lot of side effects. It might be that cannabis has fewer side effects than taking those other drugs. So, for example, patients who have a lot of chronic pain, and the only way that they can help their pain even a little bit is with large doses of opiates, which have all sorts of side effects, including on thinking and memory. If people can get off the opiates or greatly reduce the amount of opiates that they're taking with a little bit of cannabis, that is almost certainly a good trade-off, because cannabis is, much less harmful, I would say, over the long term compared to, opiates or some other strong medications. So that's where I sort of see it having a role.
Great. Well, with that, unfortunately, we're out of time. But I could talk to you all day about this. Thank you so much for not only joining us on Boomers Today, but thank you for all the wonderful work that you're doing. I really appreciate it. And it was great having you on the show.
Thanks. It's a pleasure to be here.
And thank you, everybody, for joining us on Boomers Today. Please be safe. And we'll talk to everybody next week.
You've been listening to Boomers Today with Frank Sampson. To learn more about today's show, visit boomerstodayradio.com and join us next time for another edition of Boomers Today.